And also, yeah, that's one cool. You had in front of Hinara. Oya Potaka Semino. World Bread Tumor Day. Na year to me celebrate. Abandama, our day, ye bon mazin if you to me to anamar. Na ye men chachra ho autumn no kodo. Ama a doma. Wo you sume de, ubi a damin chachra no when ya oya and for so. Fitabia was shall see what more to the mejume. Well, oya in fee. By a 23 years, we shall show 2000. Up to date, we are celebrating World Bread Tumor Day. This day is a special day for all of us, whether you are a Ghanaian, whether you are from different country. It's very important. That is why MC Online TV, always we want to educate the public concerning this special day. And my name is Omar bin Abdullah, and today we thank the Almighty Allah that we have a special guest from CCTH, that's a Cape Coast Teaching Hospital. She is my sister. So far as she's a Muslim, she is my sister. So she is Dr. Sophia Yusuf. She's going to help us to educate the public concerning World Bread Tumor Day. World Bread Tumor Day is celebrated every 8th June in every year. So we have celebrated since 2000 up to date, 23 years. Whether there is a change, whether there is a change or not, we will see or we hear from Dr. Sophia Yusuf, who will educate us. Doctor, Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Why are you laughing? Because of the salam or what?
Oh, no.
Or you think I will greet good evening?
I was assuming.
Oh, now so far as you have a veil, definitely you're supposed to.
Yes.
So when I greet Salaam alaikum is very important. Because Salaam alaikum is peace. Yes, as you know.
Yes.
Doctor, we have celebrated World Brain Tumor Day for 23 years. Latest statistics from the World Health Organization tell us that 3,000 to 17,000 brain tumor patients in Ghana. That shows that at least if a doctor is going to operate this number of people, a doctor should operate maybe 600 to 3,400 cases per year. That shows that we have a lot of work to do. When somebody asks you, what is the meaning of brain tumor? So what are you going to tell us?
Okay. So brain tumor is more of division of cells within the brain, as in they are dividing rapidly or they are being multiplied rapidly. So they form this mass within the brain, and the brain is a very enclosed area, is limited in its space. So as these cells grow rapidly and then form this mass, they end up taking space within the brain and then cause some effects which manifest as symptoms which we see on a basis in terms of clinical basis. If I should bring it down to the level of to a layman's level, I would liken it to a garden. You have a garden organized. You've planted your tomatoes, you've planted your pepper. Then you find that there are certain weeds amongst this plant. The weeds, we will say, are the cells that are the brain tumor cells. In terms of you find that the weeds grow faster than even your normal plant. And when you have them clustered at a certain place, that is what we will say it's a mass, a tumor within your garden. Or here, it is a mass within the brain. Basically, if we are using the garden scenario.
Right, well, thank you very much for giving this explanation. Now, Doc, you continue asking the causes of brain tumor. What causes brain tumor? Abazin or the brain tumor?
Okay. So, brain tumor, as a causes per se, one is not able to actually pinpoint that this is a cause, but we tend to say risk factors in our means of work. We wouldn't go on to say causes, but risk factors. Risk factors here, we are looking at genetic defects. In in the brain or even in the human body, there are certain cells or there are certain things that check the division of cells or multiplication of cells. So here you have that this check is not being done, probably because the gene supposed to, when I say the gene, it's more of a genetic language, supposed to check that the cells are multiplying in a certain way, which is organized, which is not rapid, is not doing its work, probably because there has been a change in the character of this gene. So this can happen. There's another way where when the cells divide, and then because they are dividing rapidly, it's supposed to probably be a tomato plant, but it's dividing rapidly. The tomato grows and you find that the one side of the tomato is not well formed, if one could understand. So then there is someone who will be the farmer when he's selecting the tomatoes, say that, oh, this one is proper, this one is not, and then put the right ones in a basket, send it to the market and sell. There is something like that in the human body, supposed to check, is a police, say that, no, this cell, you have a defective cell. It must die so that the right one come out. If this is not also being done, that is, there is a change in this policeman's duty in terms of there's a gene mutation, that's what we call it, then you find that the policeman will not do his job, and then these cells come out as tumors.
Right, Doctor, thank you very much for giving this explanation. Doc, we have brain, we have tumor. Can you give us these two scenarios or those scenarios? Maybe a brain is what and a tumor is what?
So brain, you have brain being is an organ within the body. It's basically what you call the central nervous system is part of it. So you have brain and then you have the spinal cord, which is more of a continuous structure. The brain within the skull continues from the brain stem to join the spinal cord. The tumor is a cell which is kind of similar to the brain cells, but there has been some changes. Changes here is, if a brain cell would actually multiply or grow within a certain time or within a limited time, no, the tumor doesn't respect time. The tumor is growing rapidly with speed. So basically, it is similar to the brain cells, but there is a change in terms of in its growth and then also in terms of in its character, basically, or function. Yes.
You keep mentioning cells. So what the cell? The cells also means what?
So a cell is the basic unit of any organ or tissue. So before an organ will be formed, there would be a cell. If I can go a little bit further to when we have how do you call it? When you have fertilization of the ovum and then the sperm, they start as a cell from cell. It starts as one, then divides, then further division. Now you have three different kind of cells formed, and these three different kinds of cell end up forming the various tissues we have in the body. So cell is the basic units of any tissue or organ you have in the body. So you have cells that would divide to form brain, you have cells that would divide to form muscles and then bone, you have cells that would divide to form what you have in the intestines and all. The blood, you see the blood vessels, you have cells for that. Everything has a cell.
Right, if everything have a cell, Doc, let's check whether adults, youth, women, men, who is at risk concerning the brain tumor.
Okay, so brain tumor I would say is not a respecter of ages. Yes, you can find it in all ages, but we have realized that it is much more in the extreme ages, meaning in children, younger children, and in older adults. So basically, if you should go further, you realize there are some tumors that affect children only. So with that, you can say there are pediatric brain tumors. So hence, probably that's why we'll say it affects the younger children, because you have certain tumors that are pertaining to children. Then you have tumors that not really pertaining to adults, but you find them more in older adults, like some malignant, or let me say, I'm using more of my terms, but I would say cancer. Yes, you would find them in older ages, between 50 to 70 years. So yes, that's what determines probably the age with brain tumor. Sorry.
Do you have a family chain? If my father have a brain tumor, can I get or what?
It is possible. That's where I explained the genetic aspect. So probably there is some genetic change which you inherit, and then possibly you are able to, or we wouldn't say possibly because it's an unfortunate issue, so we wouldn't say, but yes, it could happen that unfortunately you tend to exhibit this as well. Yes.
Right. Doc, what signs and symptoms maybe to see that you are maybe going off or you are getting to this brain tumor?
Okay. So as I first or initially explained, it's like a mass, it's like a well-formed something, and is within a cavity that has limited space, which is the skull. So as it grows bigger, it tends to take space and then causes pressure. So here you find that most patients will be like, oh, I have this headache. So especially headaches is the most presenting symptom, headaches. It could be chronic. What we say chronic, that means it's been happening for a long time. Or it could be sudden, but sudden in the sense that it is very severe and is not really responding to any medication. Usually some would say it can even wake them up from sleep. So headache is one of them, and it's an indication that there's a mass effect, there's pressure within the brain because of the limited space. Another symptom would be that you could have seizures, you could have some hearing loss, you could have some visual impairments, you could have some people coming with one side of their body in paralysis, kind of they are not able to move that side of their body. And these other symptoms are dependent on the location of the tumor, because when you have a tumor in a location where you have the visual tract, the person would come in with visual impairments or with visual symptoms. When you have a tumor in a tract where you have the auditory, they will come in with hearing issue. Where you have speech, they will come in with difficulty in talking or even understanding what you are saying. So there are various kinds of symptoms dependent on location and also dependent on the effect or the pressure within the brain. It can even go as far as patient coming unconscious, because when the pressure is so much and you are not paying attention to the headaches and all, you will end up coming and then there's reduced consciousness and patient comes in what the layman would say in coma, basically.
Yes, in coma, basically, this is what Dr. Sophia Yusuf is explaining to us. Today is World Brain Tumor Day. So far as MC Online TV is celebrating the day with the public, it's very important for us to educate the public as well. That's why we have a doctor from CCTH, that's Cape Coast Teaching Hospital. He is helping us to educate the public. Now, we are going to ask the doctor whether the treatment is easy, costive, or not. But for a doctor to answer this question, we are going to maybe to our sponsors for a break. When we come back, doctor will explain whether the treatment, the costs in it is maybe limited. If you have money or not, whether you can pay or not. Yɛkɔ break yaba, yɛkɔhwɛ ahụ na ɔbɔ medwumadi ɔtoma ɔkɔdɔ. Yɛsane ba, yɛbi sɛ doctor asɛm dɛ yɛrɛ ba nankasa no ne sa te dɛn ne kaw te dɛn doctor bi hia no nti menkɔ akyiri yɛda yɛn ho sisiae yɛbɛsa yɛ akyiri. Right, yes, and I'm on crab baby. And there, we are in Fana Hinara, or your World Brain Tumor Day. Into the day, you're celebrating a strong into now I am MC Online TV. In a saka, I am data, or I CCTH, Cape Coast Teaching Hospital, Dr. Sophia Yusuf, our boy, nephew to na Yaman Chachra, Yaman Babim. In brain tumor, Abana Mula were to me too, Abaza were to me, any treatment that na and his second will fear her, yen on here in Como. We thank you that we are back. Now, as we ask a doctor question concerning the treatment and the cost. Doc, on the treatment, how the treatment goes? Do you have treatment they can treat a person who is having a tumor and it will be okay? As he's on normal side dog.
Okay. So the treatments for brain tumor, we call them treatment modalities in the sense that it's not just one. There are various types or various methods of having to treat brain tumor. So you have certain brain tumors dependent on the size, dependent on where you find them, you would go and then use surgery to there are new ways of guiding you to where the tumor is, and then you just shell it out easily. There are sometimes you go in to do surgery, but you get there and you realize that the tumor is quite that you can't take all of it out. So you go and then you take some out, then you take it for what we call histopathology. It's just to tell you what kind of cell it is. I've been talking about cell. So you know what kind of cell it is that has caused this tumor. And then sometimes we do surgery not to go and take out the tumor per se, but there are certain tumors that you find in a location, it is blocking what we call cerebrospinal fluid. It's like water within the brain, and it flows in its own direction. So sometimes certain tumors can grow and then they block this flow. And so what we're going to do is put in what we call a shunt. So you put in something that would cause more of a redirect it into another cavity. We use the peritoneum most of the time. So it's kind of taking it out from the brain and directing it such that there wouldn't be that blockage, because when there's blockage, you find that the water will now accumulate and is adding on to the pressure that was already created by the tumor. So then you have the person having even worse symptoms. So we go to go and relieve this pressure using the VP shunt if it involves the CSF. So these are the ways we go in terms of surgery. Apart from that, you could also do radiotherapy, which we use certain radiations. I'll use my terms more. There are external beam radiations and or gamma knife. So these are directed at you are using high energy X-rays to try and then either kill the cells of the tumor or shrink it in a way. So basically that's what, so you direct it, is directed at the tumor basically. Or you use what we call chemotherapy. Chemotherapy here, we are using a chemical, a drug that is given to the patient, and the same aim of going to kill the cells, the tumor cells, basically. Yes.
What about costs? Whether national health insurance cover or unless you pay it on your own.
So this anyways, so any specialized treatment or specialized medicine, it's costly in terms of orthopedics. Anywhere in the world, neurosurgery is costly because it's it's a specialized area in medicine, so there's costs involved. In certain countries, even though it is expensive, what happens is that there's this insurance that kind of covers the cost, so the natives don't feel it too much. Unfortunately, we don't have that here yet. Our insurance doesn't cover the expenses that come with would I say brain tumor, but yes, the specialized surgery per se. So it wouldn't cover. But hopefully we will get there when one day we are able to kind of get it included in the insurance, basically.
You have passed through many months in terms of you are as a resident surgery. You know inside out. In totality, can we say we should have more confidence in terms of if somebody have the brain tumor, the teaching hospital can operate the person to become fine?
Oh yes, 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 yes. What we have here, or what is our problem here, is the fact that people don't come in early. Usually you have people starting to get the headaches, and then even sometimes you notice that there's a change in behavior. Change in behavior is also a symptom, actually. Psychiatric kind of behaviors. People see it and they say, oh no, this person, they've seen that there's a change, but ignore it to the extent that now this person is more of has some form of psychosis, or now it becomes so bad there's altered mental state. There was a study done here in Ghana, in Kolebu, and what they realized is that our prognosis here is bad because of the delayed presentation to the hospital. So mostly, I think the perception is, oh, when you go to the hospital, they won't treat. It's because you come in already late. When now prognosis, when I say prognosis, outcome of our treatment is bad. The study was able to get this an average of 2 years, that people actually wait 2 years after they've been having symptoms before they present. What do? We say, oh, hey, you're sunsum yaroba. And then we get up, go to churches, or go and dump the person somewhere. Sunsum yaraba, sunsum yaraba. Obaban, then ninywa wafra. And no matter what you do, if you go and then you relieve that tumor, because the pressure has already caused that damage, the nerves will not heal back for you to have your sight. So we should present early, and then the outcomes would also be the best.
Right. The outcome will be the best. Can stress also cause brain tumor, doctor?
So stress causing brain tumor. Actually, there hasn't been any direct link with stress causing brain tumor or any other cancer per se. But what I can say about it in my little knowledge in medicine would be that would be that stress is related with some certain, will I say hormones? No, more like with our immunity. Yes, the immune cells. There is said that when there's lot of stress, our immunity reduces, and possibly with that reduction, one can relate it to you being at risk. But is there a study? Has research proven? No, there's no research proving that stress is directly linked to brain tumors.
What about lack of sleep?
Okay, lack of sleep can be related or can be associated to brain tumors, in the sense that theoretically, when I say theoretically, we haven't gotten to, everything is evidence based in science. We do experiments to make sure that, okay, whatever you are saying, this is true. But theoretically, from what we have seen in our clinical settings, we have realized that when someone has lack of sleep or their sleep is inadequate, it is associated with brain tumor, in the sense that there are reduction of certain chemicals we call antioxidants, which normally are released during the sleep hour. So if this is happening, you realize that they are kind of the police checks in a way within the body, making sure that certain mutations I have mentioned don't happen. So if this is not being checked, yes, we can associate it with brain tumor. Apart from that, people who actually might be having brain tumor would present with lack of sleep, actually. So it's like a pro-tumor kind of manifestation as well in brain tumor. Yes.
Right. Doc, let's see these. Do you have types of brain tumor, and how many types do you have?
Okay, so we have types of brain tumors, and this one I'll try and then not mention big names. So we have let me say primary brain tumor. When we say primary, that is something that is starting within the brain, is of the brain. Then you have metastatic brain tumor. That is, it's coming from far away. It's not from the brain, but from another organ, probably from the lungs or from the breast. So you have a lung cancer or a breast cancer, and some of these cancer cells pass through the blood, and then they get into the brain and then also deposit themselves here. So first, these are the two types. So the one that has to do with the primary, that is of the brain, you find that there are some that have to do with the brain cells themselves. As I said, every organ starts with cells. So there are certain cells within the brain, they now change their character and be multiplying rapidly, and then cause the tumor. So they are cells of the brain naturally. So we have cells of the brain, which are the glial cells. That I wouldn't want to mention big names. So, and then you have non-glial cells. They are within the brain, but not actually typical cells of the brain. So that's the blood vessels you find in the brain. There are some glands in the brain. One famous one is the pituitary gland, which is also known to have its own tumor, pituitary gland tumor, and it can manifest in a lot of ways. So yes, apart from that, we have WHO has designed a way of classifying these brain tumors for you to know the outcome, what we call prognosis. So there's grade 1 to 4. Here, what it teaches us is how we can say that, okay, this will turn out good or the prognosis will be bad. Grade 1 is usually what we would all want, that everyone has, because it's a low grade and prognosis are the best. And then you go all the way down the ladder to or let's say up the ladder rather, to grade 4, where now it's of worst prognosis. Here they are very aggressive. When we say very aggressive, I'll come back to the garden, where you have the weeds growing, around the plant. There are some that would just be clustered somewhere, but then there are some that acts like creeping plants. I don't know if you've seen certain walls have these plants, they just go around, they have these pink flowers. Yes, the grade 4 can act like that. They infiltrate everywhere. They have no limits. They are just growing and then just infiltrating all areas. And if you have a tumor acting like that, in a layman, even a layman how are you going to take out that tumor when it is not well defined and it is going to all places? Then that means you take half of the person's brain away. So basically, yes, that's how we would classify, from having classified as primary and then metastatic. Under primary, we have those who are more of the cells of the brain, and then those who are not, like they are just within the brain, which are the blood vessels and all. And under this, you have what we call the benign and then the malignant, which is the cancer, which I have explained according to the grade, low grade and high grade.
Right, the man Doctor Sophia Yusuf Ottoman Bible which I Yansan so there, you have the final inera in there your World Break Tumor Day. Into all the medana, or you to Yusiazi, Yumhazi, you trying to mar offer the Midmedipi home. A shara horror to suffer I add that teleful, Mobaka Sature, I am Quancubiera, or I Sherfi, and more to one number of power to moto. Name I do. Meanwhile, Papa, Saint Rande. Say you were teaching hospital of Infirman Tomaha. Na the may be anything can see is in brain tumor. A brain rampo, a baby may not corner, and so the tumor no so to my baba count. Until HLS Apollo, so yeah, I will Infirman to our Cape Teaching Hospital. The men may have 2 times a more home, the specialist I will fear or a resident surgeon. I said, if or yeah, a gentleman should shape Paza. Say, Arabo Dom Hunizana. You can quote in quote or yeah. Dr. Sophia Yusuf, the Ebutum Day nephew, or Canada, or those can. I'm in America. We're teaching hospital. I'm a musician, although 2 months can pa. Was an extra young baby, more to my baby, and a chair, you were con to. You are this year. No, be a papa there. Be better about how he was in our gentleman. Yeah, but imagine if you to me, Yako, or your hospital. And Yako, Mudinas, or any few to me, Yako, you should send it there. I will fear my brother, madam, that's okay. Hello, soon, Yerba, into your Francoha, now Quacker, garden, Wabunsa, would see Wabuma, pum, and the baby would say, yo, send it was soon, this will be dinner with him, soon, maybe dinner with him. The banner soon, maybe. Soon, maybe. That is today, Yanko or ya upon the nursery, Nefi, Yanko Christian, Abandama. Doctor says, KGP. Ebokon nature, so by your crampa, or would be miniatures are, or better one a second, no one say to manka. Or be a papa level mother if you to na, Yako or ya upon the nursery. On chat, they am him, or send a science are banner outdoors, papa. Yako or ya doctor her, Dr. Sophia Yusuf, ne ye a kibis and day. The midday, maybe I celebrate, yes, shall see celebrated the midday, or your 2000. The Visibri, 23 good years. Abba sissa, no word to me now, Abba. Abba number, the year to me now, year to year 2, often, or your brain tumor. Doctor.
Okay, so basically, it has been set aside, this day, 8th June, has been set aside to create awareness that brain tumor exists. As I said, in our own setting, because of our cultural beliefs, it makes it even difficult. So there's much more work to be done. And thank you for having me here to be able to to be able to get this opportunity to educate. So it's a day of awareness, it's a day of education. It's a day when even anyone who would listen to this, or even having had an encounter of having the knowledge, would know that, oh, okay, I can help my relative in a way, either financially, either just being there and noticing these symptoms we have talked about, and then find the appropriate solution. And here I will stress on appropriate solution, because our methods of finding solution is a lot of runabouts. So appropriate solution for the relative or whoever might be having this condition. basically.
Doc, we're going to rise very soon. Let's see, should I then continue checking on this brain tumor monthly, yearly, or what?
No, no, you don't have to do continuous check. It's not like any other cancers that you would say, like breast, you would advise someone to examine their breast, or you have the prostate cancers, we would say, oh, they should do some PSA. With brain, for you to see inside the brain, we need to for you to do something we call the CT or the MRI, and these are radiation sources. So, I forgot to mention that it could be so radiation is also a way of having or a risk factor to getting brain tumor. So, wouldn't advise anyone to be exposed to radiation continuously. Rather, what we would stress on, and I will stress on it again, because even in my own practice, my short practice in the neurosurgery unit with under my boss, working under, he's a neurosurgeon at Cape Coast Teaching Hospital, Dr. Ajin Mensah. I realized that most people come in either they ignored the symptoms. We have had people come in unconscious, and then finally we use certain medications to try and then reduce the inflammation or the edema around the brain tumor. So as I said, it's a mass effect. And so when we do that and now later we go back in medicine, we call something history. We take the history of the patient. Then relatives will say, oh no, started actually to that 1 year now, also little pen, or started all kasa. And they waited and waited and waited. So I would stress on the symptoms, please, the headaches, the seizures. The person's character has changed. The person says, oh, I can't see well. The person says, oh, I'm not hearing well. You are talking to the person about A and he's telling you about Z. All these things, we should have our eyes open for that. And when we notice or when we see, please, then you report to the hospital. Then we use what gives us the eyes into the brain, which is the CT, and then the MRI to now confirm diagnosis. From there, we go ahead to do certain biopsies if there's a way of getting to that location, because there are certain locations you wouldn't want to go there, and then we will use that, confirm our diagnosis, and then give you the appropriate treatment.
When you were talking, you mentioned the seizures, the headache. When you immediately mentioned the seizures, I put my mind on epilepsy. Can epilepsy also cause this, or epilepsy is not part of this seizures you are talking about?
Okay, so epilepsy, it's more of it's a disease, but it manifests itself in a way of seizures. When we say seizures, it doesn't necessarily mean the person has epilepsy. But I know most people see people having convulsions and then a stroke, then they assume it's epilepsy. No. In brain tumor, normally when there's an irritation on the brain, the person starts to have seizures because of the irritation. And in epilepsy, it's more like there's a continuous emission of more like electrons. So it's like electric. So then with that, you have that kind of so it's like a disease on its own, but then it manifests as a seizure. Yes.
Then epilepsy no answer. Before epilepsy no answer. You back doctor ho a little advice be around tomorrow azema or ya domi hinaran na cheji medin here to me za baby. Into doc, your advice to the Ghanaian, to the world.
Okay. So my advice is, please, let's be each other's keeper. Being each other's keeper here is that, please don't ignore things when you see them. You've seen that your son is acting some way. Don't be, oh no, it is the age group he's gotten to. Your daughter comes home telling you, I'm having this persistent headache. Don't ignore. You have an older maybe your grandma or something telling you realize that, oh, now their walking has changed, they are not hearing right, please don't ignore. Let's be each other's keeper in having to notice these things and then help where we can, whether it is financially, whether it is having to send this person to the hospital. Please, I am begging again. Sunsum Yarba, I beg. Onye Sunsum Yarba. We are also, in a way, created by God, given this knowledge and skills to be able to be of service. And this is the way we can be of service to you. So please come to us when you are having these symptoms so that we can also help you when the need be. Don't go to the church homes and then come back and we are supposed to do some magic of a sort, which we will not be able to do. And you might think the hospital hasn't helped you or the service was not to the optimum. So please, my advice is still on the fact that please notice the symptoms and come early. No more delayed presentations. Thank you.
Thank you to the doctors. ADBC. We'll draw our curtains here. We'll thank Dr. Sophia Yosef. We thank her very, very, very much from our CCTH, that's Cape Coast Teaching Hospital. She is a resident surgeon and she has helped us a lot, educate us a lot. We thank her very much, as well as her leaders at CCTH. Now, Mama Shana, so there, it's in and also here, my Biara, Yeri Biaran, Yetumezia. So, what's in you are into Menanto? Obian, you are Butumina, Nitin, or get your paper. What's in Noble because it's in you are when you are, it's in you are when you are, it's in you are one in you are. It's didn't know, but Otto Chimara, a Sampi, Yane to Menaba. Now, we answer so that is the day of bread to bear and Zeme Biara about him, Biaran. Biara, what are you to me? Man come alam ho, man couldn't see ho, man call Baba for Serba Fatuo, name Quapumidina soy, now Quacapiro, I wapum within some honorable about Amma in when it dead, say will bring tumor, will turn a moron. Doctors say, Tinefia Cherpa, and son about one way you will there. I will break tumor. None in the Mepi or Hancha, what pet day was Senate Domino, natural Senate Domino. No much so there. Feel for man tumor, I hear you where's he try and cook. Or Sunny day. You sure or your CCTH, Keko teaching or your hospital. Naturally, painful Pia, we ain't show for or your bread to Moha, Junum, Yaraban, who some say, Pio, into a chede, who ran a baka. Until Mamma's nephew of Britain, young Tanama, nephew young co or your teaching hospital, near Kosher or your Henny, your baby about my bed. Now, Kosai, see about can no cross it there, add that telephone. Or say, Yaban, why, how I feel, I quite said, one man tiara, Abanamana, and far a boko papa. You didn't bring good history in which the doctor will follow to do the investigation about it. Inti obi here papa ye kwa yenka no kwa. Se mfie bie na atene fie ankwa na ye yaraba na akwa kan da mfie bie.